Assalamualaikum to my lecturer, Madam Nurul Alia. My name is Muira binti Zulhairi. Today, I would like to do a presentation on an application that has been implemented by Mosti in handling COVID-19 pandemic. There are 8 points that I would like to discuss in this presentation. Firstly, what is COVID-19? COVID-19 is a novel coronavirus ataupun a new strain of coronavirus that was emerged in December 2019 and firstly identified in Wuhan, China. COVID-19 linked to the same family of virus as SARS ataupun Severe Acute Respiratory Syndrome. It is known as pandemic since the outbreak involved over a whole world and affecting large number of people. COVID-19 patient might experience a mild fever to pneumonia and symptoms such as coughing, sore throat, and shortness of breath. How COVID-19 spread? First kali, by direct contact with respiratory droplets of an infected person through coughing or sneezing, and when we touch object ataupun surface that has been contaminated with virus. So, there are several precaution steps that we must practice. The first one is wash hands frequently. The second one, when you are sneezing or when you coughing, just cover your mouth and nose with flax elbow or tissue. The third one, avoid close contact with anyone who has cold or flu-like symptoms. The fourth one, if you are having fever, coughing, difficulty in breathing and not feeling well, just seek for a medication. Then wear sanitizer frequently. So far cases in Malaysia, until 27 June 2020, there are 8,606 which is confirmed cases of COVID-19 with 121 deaths. So, what is the role of Ministry of Science, Technology and Innovation ataupun kita kenal sebagai Mosti? Jadi, di sini ada 3 keratan akhbar yang menunjukkan Mosti telah mengambil langkah-langkah ataupun inisiatif bagi membendung penularan pandemik COVID-19. Jadi, Mosti telah melancarkan 2 aplikasi bagi membendung COVID-19 pandemik. Kita akan lihat apakah fungsi aplikasi tersebut, bagaimana aplikasi tersebut bekerja dan di mana kita dapatkan aplikasi tersebut. Applications that has been implemented by Mosti in managing outbreak of COVID-19 ialah My Sejahtera dan My Trace. Okey, apakah itu My Sejahtera? Firstly, we need to know. My Sejahtera adalah application that has been developed by Government of Malaysia through a cooperation between Mosti, NSC, MOH, Mampu, MCMC. My Sejahtera akan assist government in managing the COVID-19 outbreaks in Malaysia. Function dia yang pertama adalah dia enable Ministry of Health ataupun MOH to monitor users' health condition and take immediate action if the user is suspected with COVID-19 infection serta provide the treatment. Second one, My Sejahtera allow user to monitor their health progress through COVID-19 outbreak. Yang ketiga, My Sejahtera allow user to perform health self-assessment on themselves and their family member. Dan yang terakhir, My Sejahtera ni dia akan membantu kita untuk locate the nearest hospital ataupun klinik for COVID-19 screening and treatment. My Sejahtera ni digunakan oleh Malaysians and residents of Malaysia serta administrator in the MOH. Kita boleh dapatkan My Sejahtera ini dengan minimum requirement of mobile devices. Yang pertama, smartphone yang running Android 4.0 and above dan juga iOS 10 and above for iPhone. Yang kedua, mestilah ada internet connection dan yang ketiga, able to receive SMS for the system to send the OTP untuk verification process. Okey, My Sejahtera ini kita boleh dapatkan secara percuma di gambar ataupun galeri aplikasi mudah alih kerajaan Malaysia, Apple App Store untuk pengguna iPhone, Google Play Store untuk pengguna Android dan juga Huawei App Gallery. So, there are a few steps to use and register My Sejahtera. You just need to register by following the steps on the slide given. Basically, ada 9 step untuk download My Sejahtera dan cara penggunaannya. Untuk maklumat lanjut, bolehlah layari Fact My Sejahtera app dekat website yang telah diberikan di slide di bahagian bawah. Next is MyTrace. Okay, MyTrace adalah application yang developed by the government of Malaysia through a strategic cooperation between the Mosti, NSC, MOH, Mampu, MAGIC, MyMos, Universiti Islam Antarabangsa IIUM dan juga Google. Okay, dia complement the MySejahtera, able to download MyTrace ni through the link in MySejahtera apps. Function MyTrace ini adalah allow identification atau dia akan trace people who were in close contact to COVID-19 infected individual. All the data collected will only be collected, stored and processed by the MOH officer. Then dia akan enable the MOH to further trace contact and organize further treatment. Macam mana dia bekerja? So, MyTrace ni dia menggunakan contact tracing application dengan Bluetooth technology. So, dia akan detect bila mobile user with MyTrace dia pergi dekat other MyTrace user. So, Bluetooth ni dia akan detect their presence lah. Okay, jadi MyTrace ini digunakan oleh Malaysians dan juga residents of Malaysia. Minimum requirement of mobile devices to use MyTrace adalah smartphone which running Android versions of 8 and above, iOS 10 and above, have internet connections and able to receive SMS for the system to send OTP for the verification process. Jadi ini adalah step untuk menggunakan and register MyTrace. For further information on how to download the MyTrace for Android and iPhone, ada diberikan dalam website yang telah disediakan di slides. Okay, jadi siapakah yang sepatutnya download MyTrace ini? Kita akan mulakan dengan when the patient goes to the hospital for COVID-19, dia dah undergo screening and dia positively COVID-19 patient. So the doctor ni dia akan meminta patient tadi untuk download MyTrace mobile application tu tadi. Jadi the doctor dia akan log in into system and find the patient's phone number. The doctor will read the version ID of the patient to verify the version's ID is correct or not. Then the doctor will give the PIN number to patient. The patient clicks verify sebab dah sama kan. So patients enter the PIN number and click submit. Okay, jadi a lot number is generated after the clicking submit, then dia akan valid selama 21 days. Okay, only the doctor can view the lot number that has been generated. The Bluetooth feature will capture other user UUID if they get contact, meaning bila patient tadi yang ada MyTrace application tu tadi, dia go to the other user yang ada MyTrace application tu juga, jadi secara automatic Bluetooth dia akan sense ataupun akan detect. Okay, so dia boleh detect lah apa ni kat mana berjumpa, places dan juga masa diorang bertemu. Macam tu. So the doctor can view and print all the lot number that has been captured by the patient tadi. Then the doctor dia akan give the list of lot number to the authority. Okay, so there are differences between both applications, MySejahtera and MyTrace. Okay, we have to differentiate both of them. MySejahtera ni is we allow the user to perform a quick self-assessment, then they allow MOH to monitor user health condition and take immediate action to provide treatment. Whereas MyTrace ni dia detect and dia trace individual yang ada close contact with positive COVID-19 patients. Okay, so that are the difference between MySejahtera and MyTrace. Lastly, there are disadvantages of the applications that has been implemented by Mosti among Malaysians. Firstly, high cost to buy smartphones due to the compatibility of phones with application version. The second one, applications will be downloaded by certain people due to incompatibility of the applications with their smartphone. Yang ketiga, mostly elderly people will prefer traditional way ataupun paper-based as the technology will cause difficulty to them. Yang keempat, not all shops provide barcode administration. Ada sesetengah kedai, dia tidak ada barcode administration untuk administer MySejahtera application. Dia just sediakan sebuah buku dan kita hanya tulis nama, nombor telefon serta body temperature kita lah, ataupun itu kita panggil sebagai paper base. Okay. Kemudian yang seterusnya, users of a MyTrace might forget to switch on Bluetooth dan akan menyukarkan contact tracing tersebut lah. Kemungkinan user ada contact dengan other COVID-19 patients tapi mereka tidak detect sebab lupa untuk switch on Bluetooth. Dan yang terakhir sekali, it is not really reliable as sometimes user can hoax the personal information like body temperature dengan cara menipu body temperature. Okay. Here are the references what I used to refer in performing this presentation. So, I think that's all from me. Thank you, and I really hope that you enjoy my presentation.